here. Okay, I'm just waiting for it to connect. Let's see here. Alrighty. Hi, everyone. Welcome to today's speaker series. We're going to go ahead and just wait a couple minutes for everybody to join and get settled. I'm sure we have a lot of people joining us on their lunch break and everything. So very excited to have all of our guests today. In the meantime, let me go ahead and introduce myself and tell you a little bit about Paloma Health. So my name is Alex Ruiz. I am the Director of Content Community here at Paloma Health. And who are we at Paloma Health? We are an online medical practice that specializes and focuses on treatment for hypothyroidism and Hashimoto's. But, you know, unlike a bunch of these other companies out there, we are more than just a test kit. We offer full functional care. Our providers are able to see patients, you know, do a request labs, medication refills. And I think a lot of people don't realize that, like I said, we are a full online medical practice. So we do offer at-home test kits, which is really awesome, especially for people, you know, we hear time and time again, patients who live in rural communities and have to commute an hour plus out of their way just to get labs drawn. Even especially just seeing their doctors, you know, it's a commute, let's say an hour and a half for them to be there for like, let's say 10, 15 minutes and then drive another hour and a half back. Time and time again, we hear patient stories like that. So yeah, we're a virtual medical practice, so we can treat you from the comfort of your own home. We also have an app, which is really amazing. A lot of awesome features, such as symptom tracking is a big one, medication reminders, which I know for myself is so crucial time and time again. You know, you would think you would get used to taking the medication, but you just forget sometimes, or sometimes that, you know, it passes by. We also have other features such as workouts, meditations, guides, everything like that on our website. We have so many blogs, which Mary Showman here is, you know, spearheading and leading and helping support us. Really just create so many great resources for you. So that's us here at Paloma. And, you know, without further ado, we're going to go ahead and get started for our speaker series. We're going to be talking about all things dieting, you know, the effects that it has on your thyroid health, your hormone health, and just in general, what we can do from a lifestyle perspective and how to really implement that change for a symptom that, quite frankly, people with Hashimoto's and hypothyroidism really, truly struggle with, and seems to be the number one thing that people want to combat. So without further ado, I'm going to go ahead and introduce our host for the day, Mary Showman. And Mary, yeah, take it away.
Thank you, Alex. Today is going to be an exciting conversation because we have some real pros with us to talk to us about one of the topics that's near and dear to my heart and to many of yours, which is the issue of maintaining a healthy weight when you have hypothyroidism or Hashimoto's, or in the case of most of us, both conditions at the same time. So we have two perspectives that are going to really, I think, help illuminate the situation for those of you joining us today. And we're really thrilled to have everybody here. And we will be having it towards the end of the presentation, we will be having an opportunity for you to ask your questions. So if you haven't already shared a question, please type them into your the thread at our community area. And Alex is going to be helping us keep track of all of the questions so that we can share them with our incredible speakers today, who I am going to introduce you to now. We have Kevin Passero, who is a naturopathic doctor, and Dr. Passero is the owner of an incredible medical practice called Green Healing Wellness Center. And he's serving the DMV, which is what those of us in the Washington, D.C. area call the D.C., Maryland, Virginia metro area. And we also have Jill Ellison, a Paloma Health coach, certified coach, and really one of those people that can get in there with patients and help them translate their goals and their aspirations from a health standpoint into reality using practical and supportive approaches and tools and techniques. So we're going to go ahead and I'll be starting first, introducing you a little bit more. I'm going to give you a little bit of bio information about Dr. Passero, and then he's going to give us a little bit of information about himself as well. So Dr. Kevin Passero, as I said, is a licensed naturopath who's graduated from one of the 8 accredited naturopathic medical schools in North America. So those of you who aren't familiar with naturopathic physicians, they go through medical school with internship and residency and the entire process, just like a traditional medical school, except there's actually, what I've heard, Kevin, is that the course load is actually larger because they have to cover all of these holistic elements, natural medicine, bringing in supplements, vitamins, and lifestyle factors as well. So Dr. Passero's focus is on providing natural and holistic therapies here in the Washington, D.C. area, which is where I'm also located, and educating people on the value of naturopathic medicine across the United States. He focuses in on a very individualized approach to medicine. And I can speak from experience because I've benefited from his incredible advice. I've known him we were trying to figure out, we think 15 to 20 years that I've known Kevin. And he has just been a tremendous asset to so many people, not only with thyroid problems, but with a wide variety of sort of mysterious illnesses. In fact, Kevin, I don't know if you know this, but I always refer to you as the Sherlock Holmes of integrative medicine.
I know. I almost got my hat and my little magnifying glass for the call today.
Exactly. So Kevin really focuses in on coming up with very individualized solutions. It's not enough to just deal with symptoms. In Kevin's approach, he wants to find out what is the underlying issue. Why is the body in distress? And how can we restore optimal health? So he did his post-grad naturopathic medical education at the Natural College of Naturopathic Medicine. He got a bachelor's degree in environmental biology. So he is somebody who wants to do good for the world. He's also former president of the Maryland Naturopathic Doctors Association and actually helped get licensing standards set in so that naturopathic doctors can practice in Maryland. Yay. And he's an active member of the American Association of Naturopathic Physicians. So I am so pleased to welcome Dr. Kevin Passero. And Kevin, why don't you tell folks a little bit more about yourself and your interest in hormonal health and thyroid and autoimmunity and weight loss issues?
Yeah, well, I mean, if you've been doing this work for this long and you're really focused on trying to holistically help people get better, you have to start digging into these different areas and looking at things like thyroid health and hormonal balance, right? And a lot of traditional models where it's more symptom management, it doesn't go down below those deeper levels. So if you're really, really listening to people, really, really hearing what they're going through in their experiences, and you're really committed to trying to get their body balanced, you have to start digging in these areas. So, chronic digestive issues that need to get resolved. We'll talk a lot about thyroid stuff today, but there's a lot of just scratching the surface in most traditional approaches to looking at thyroid related care. So really understanding that, and then you can't separate out these different hormonal systems in the body. No one system lives in isolation, even though that's how the medical system is set up. You have an endocrinologist for your thyroid, but you have a gynecologist for your sex hormones, and you have a different approach with an endocrinologist if you have a diabetes issue, which is usually a hormonal endocrine issue with insulin and the pancreas. And nobody's really trying to pull it all together, right? Nobody's talking about food, which Jill is going to talk about today. And, so if you really want to do this work the way that it should be done, you can't not go into those issues. So my whole practice, my whole career, the whole root of naturopathic medicine, I mean, that is where functional medicine came from, is to really look at these things holistically, integratively, and to do the kinds of evaluation, whether it be testing or just good in history taking, to get as close as you can to a root causative factor or create the kind of protocols necessary to balance the systems of the body holistically.
Terrific. Thank you.
Mm-hmm.
I'm also going to introduce to everyone Jill Ellison, who has multiple initials, CHHC, NBC, HWC. She's got a whole alphabet after her name. And Jill is a Paloma Health coach. And she is a board certified holistic health coach. And she's been working for more than 10 years in holistic coaching to help patients improve their health and well-being and really be the best version of themselves. She partners with individuals, patients to create a wellness plan and a roadmap that's going to help them achieve their goals that are most important to them, and learning and incorporating and practicing lifestyle habits that they can incorporate into their lives and make part of their lives organically, rather than feeling like it's imposed on you from the outside. That's the essence of good coaching. And Jill knows all about that. So Jill, welcome. This is your first Paloma Speaker Series event, and we're thrilled to have you. And we hope it's the first of many future events that you'll be able to join us for.
Thank you, Mary. I'm excited to be here. Coaching is near and dear to my heart for a lot of reasons. I've only been health coach official with all of the different letters behind my name for 11 years, but really health and wellness is something I've been passionate about since a little kid. It's just been kind of inborn in me, and I've spent many years helping myself, helping others. And it was finally with the encouragement of my husband to figure out how I could make this actually into a career. And then I discovered health coaching and got certified. And I absolutely love it, because much of what Kevin was talking about, they have this just disjointed care from different providers, or they get a diagnosis and they just don't know what all to do and how to get relief from what they're experiencing. Or it could be the opposite. They know a lot of things to do for themselves, but they don't know how to go about implementing it, what's going to work best in their lifestyle. And that's really where coaching comes in, is that partnership, being able to look at things from that 30,000 foot view and help them see and really help them self-identify what is going to be best for them and how do we implement that, and being that partner to show them the confidence and the inner wisdom that they truly have, because we can be so hard on ourselves at times. And so really helping them build that autonomy so that they start to take action, and then they start to see results, and then just everything kind of starts to flow from there. And it's a really fun partnership. I really enjoy it.
Wonderful. Thank you. And we're so excited to know that you're going to be able to be helping patients really make those plans to live and feel well and have a better life. We've got some questions that we've put together for our experts here. And so we're going to go through a few of those questions. And again, you're invited to share your questions in the comments area. And we'll be sure to try to get those covered as part of our program today. But we're going to go ahead and start out. And this actually is a question for Jill. And after we get Jill's thoughts on it, Kevin, if you have some thoughts, we would absolutely welcome the part of the conversation here. But this is something that a lot of thyroid patients have gone through, which is basically yo-yo dieting, yo-yo weight loss, weight gain, and in some cases feeling like you're always on a diet, chronic dieting. And this is an issue that a lot of thyroid patients are going through, because they're trying to lose weight. They lose weight, then they regain the weight, then they have to cut their calories dramatically. And Jill, can you start out by kind of giving us a little bit of an idea of what you've seen with thyroid patients, and in terms of that particular pattern and how it plays out for them?
Yeah, absolutely. And really, it's not just for thyroid patients. There's a lot of people that fall in this category. And a lot of it comes, I think, from the diet culture that we see and we hear all the time. So when somebody decides they want to lose weight, their first thought is, I've got to drastically cut my calories. I've got to start exercising. And they drop the calories so much that there in the beginning, the metabolism does respond. It is going to have that quick little response to that. They're going to lose some weight quickly, but then it tapers off really fast, and then it gets stagnant and they're not seeing any more results. And because they've made such drastic change, they find themselves in this place where it's like, this doesn't taste very good. This isn't very fun. I'm having a really, especially if they've got other family members in the household, they're having a hard time not feeling like a short order cook or doing things separately. They find it difficult to be in social settings or be outside of their home. It might get expensive. All of these things start to snowball. So our cortisol levels are rising because it's starting to stress us out. That starts to impact your sleep. Like, just all of these things start to become a factor. And then that's where most people say, I give up. I can't do this anymore. And then our poor metabolisms are just kind of confused, and our bodies are confused at this point, going, well, sometimes I get to eat and sometimes I don't get to eat. So we tend to store more fat. We tend to hold on to everything, even though we are, eating well and we're exercising and we feel like we're doing all the right things, but our body's still just not quite trusting in the process. And that's at least what I'm observing most of the time.
Okay.
Then, as this relates to people with a thyroid condition, your thyroid is part of what regulates your metabolism. So if your thyroid's already underproducing, it's already impacting how much your metabolism is working to begin with. Then if we start to send all these mixed messages to the body, the metabolism gets even more confused, and then our body just wants to go into a protective mode and then just say, I'm just going to hold on to stuff because I just don't really know what's going to happen all the time. And that's really what I'm seeing a lot with the people yo-yo dieting, getting on, getting off, and could be a contributing factor as to why they don't see, slow, steady, gradual weight loss that's sustainable, is because they haven't quite figured out what are the habits that they need to engage in that do make this a lifestyle, that
Right.
do make this go at a pace that I can continue to maintain for the rest of my life.
Okay. Well, Kevin, we've got these patients that are coming to you, and you have probably heard stories like what Jill is explaining over and over again with patients coming into your office. But
Yeah.
what's going on with Hashimoto's and hypothyroidism patients that is making it so difficult for so many of them to lose weight? Even people that have never had a problem before, their thyroid goes haywire, and all of a sudden they're dealing with a weight issue. Certainly was the case for me. I never had a weight problem until my thyroid went haywire, and all of a sudden, everything I ate, I felt like made me gain weight. So tell us what are the factors that you're looking at that you think are really putting that challenge in front of people with Hashis or hypothyroidism?
Sure. Well, let me touch on the question you asked Jill real quick, 'cause there's a couple things. One is like the psychological implications of yo-yo dieting and weight loss and weight gain are really difficult. And people come in with a lot of trauma around dieting and around not being able to control what their body can do. And I think it's really important from a clinical standpoint to make sure that people are set up for success, which is going to lead us to this question of why can't people with thyroid issues lose weight? So a lot of times people will come in with the desire to lose weight, but if we identify that there's a thyroid issue going on, I don't want to incorporate really any significant energy towards weight loss goals until that is squared away, because there's nothing more frustrating for people that have been through ups and downs and yo-yo diets for sometimes decades or longer than to try another one and not have success. So it's so important that people get the foundational things set up right, because this psychological disappointment and trauma of not being able to get where you want is really hard on people. And it's something that I'm really sensitive to in my clinic. The other side of it is like yo-yo dieting is a huge problem when you're doing not just the effects it has on your metabolism, like Joe was talking about, but if you're somebody that loses a lot of weight quickly and then you gain it back, what we learned is that when you'll lose it sort of evenly over the body, but when you gain it back, it preferentially redistributes into the visceral area. And the
Great.
visceral fat is the most dangerous fat. That's the kind that's associated with increased cardiovascular risk, stroke risk, cancer risk, diabetes risk. So you could have the weight, you could be 10 pounds over your goal weight or 20 pounds over your goal weight, but it's kind of nicely distributed around the periphery as well as the visceral area. You lose it real quick from a crash diet. It's not sustainable because you didn't set up the habits like Joe was talking about. You gain it back quickly. It's going to redistribute preferentially in a much more dangerous place. So it's really important that people understand that when approaching diet, because we live in such a diet culture. Now, when it comes to why people with thyroid disorders have trouble losing weight, or why all of a sudden they feel like their body has been, hijacked or doesn't respond anymore, is because the thyroid hormone sets metabolism. It's very, very intricate. Thyroid hormone not only, unlike other hormones, has to bind to the cellular receptor, but it has to get inside the cell and actually interacts directly with the DNA. And it sets all forms of metabolic activity and ATP production for every single cell in the body. So if your thyroid is not properly balanced, not just on blood work, right, on a cellular level, you are going to be in a state of hypometabolism, under metabolism. And if your metabolism is slow, it sometimes doesn't matter what you do from a standpoint of diet, exercise, lifestyle, you are going to have a very difficult time moving the body in the direction that you want as far as releasing weight. So, I don't know if I need the answer to be any more complicated than that. It's as simple as it gets. There's one hormone that is in charge of setting metabolic activity of every cell, and it's your thyroid hormone. So if that is not balanced, and I'm going to say it again, at a cellular level, because blood tests can be deceiving, right? The blood tests are measuring what's going on in the blood, not what's going on in the cell. Mm-hmm. So you have to understand that even perfect blood tests can be present in somebody who is cellularly hypothyroid or not properly balanced that way. And they will, even though they look perfect on blood work, will have the same struggles that they will have had before they were even regulated on whatever supplements, medication, treatment option they've been given.
Mm-hmm. And we hear a lot about thyroid patients also being more susceptible to insulin resistance and leptin resistance, and that these two factors can also contribute. So it's not just that we are hypometabolic due to the thyroid issue, but that it's also setting in motion some other endocrine imbalances that also add on, or they pile on to the difficulty losing weight. Can you talk a little bit about the insulin resistance and leptin resistance issue as it relates to thyroid patients?
Sure. Well, those issues are going to relate to a lot of things outside of thyroid issues, but just like I talked about in my introduction, you can't isolate these systems out. So if you're hypometabolic from a thyroid perspective and you find yourself gaining weight, you're going to gain weight in the visceral area, and you're going to start, getting fat deposition in your liver where your body doesn't want it. And as soon as your body starts getting these cues, it's going to start down regulating its responsiveness to other endocrine chemicals like insulin. So you're going to develop some insulin resistance. Your body becomes less efficient at processing fat. You'll see it in hypothyroid patients, even if they don't have weight gain. If their thyroid isn't adjusted properly, their cholesterol levels will go up almost immediately. So the body's ability to process fat declines in a hypometabolic state. And if your body's not processing fat, even fat that you eat in the diet. So when you eat a high fat meal, you coat these little, what are called caveolins, these little areas of your cell membrane that when they are clogged with fat, your cell can't respond to insulin. So high fat diets make you somewhat insulin resistant, that I have seen. And if your body's even struggling additionally because you're hypometabolic from thyroid issues and can't process the fat that you eat, you're going to promote even more insulin resistance. And then leptin also comes after that. Leptin is this hormone that kind of makes us feel more satiated from food and makes us want to be more active, right? So it does these great things. It makes us want to eat less and move more. And leptin resistance builds up just like insulin resistance. And it comes with the visceral fat, it comes with the insulin resistance, and all of that, in my opinion, kind of cascades down from the hypometabolism. Now, you can fix somebody's thyroid and get their metabolic state right, but if their thyroid hasn't been properly balanced for 5 years, 10 years, 3 years, and they've, let's say, gained 30 pounds over the course of that time, fixing the thyroid isn't going to undo everything like magic. It's going to reset the metabolism so that when they then engage in a proper lifestyle and nutrition plan, their body will respond with the weight loss, with the reversal of the insulin resistance, and move back to a state of better balance. So it does take work, but there's no point, in my opinion, even engaging in that work if you haven't set the proper stage, which goes back to what I said before.
So the thyroid is the foundational component. When we're dealing with metabolism and weight, we've got to look at the thyroid as the first step before we start focusing in on all of the other factors?
It's got to be accounted for, because
Yeah,
if you miss it, not everybody's going to have it. Not everybody has a thyroid issue. I mean, most
right.
people on this, broadcast are probably here because they have a thyroid issue, but some people won't. But if they do and you miss it, you are going to put that person through a lot of um, work, effort, energy to try and lose weight, and they're never going to get where they want to be. And that is what leads to a lot of the frustration, a lot of the trauma, a lot of the disgust, and then people start to lose confidence in their body. And there's nothing sadder than people losing faith in their body's ability to heal,
Mhm.
and the wonder and miracle that we all have in our bodies.
Jill, we're going to talk about one factor that, and I know it's a factor that Kevin considers important too, but you probably talk with a lot of patients who are increasingly aware of the concept of inflammation and the role that it plays in their health, and it's a factor in weight loss as well. So can you talk to us a little bit about the how food choices affect our degree of inflammation and how inflammation plays a role in this whole picture of what we're talking about as far as maintaining a healthy weight and having metabolic health?
Yeah, inflammation it's a big topic these days because we're finding more and more that, the root of a lot of chronic health conditions is in inflammation. And it's important to know that we all have inflammation in our bodies, but there's different types, and there's the types that we need in a short term. You get sick, you have a fever, you need that immune response, you need that inflammation to get rid of your illness. And the inflammation that we're talking about here, it's the chronic inflammation. It's the inflammation where our body is treating us like we have a foreign invader all the time when we really don't, because it's coming from different lifestyle habits or different foods that we're eating. We're finding that the more processed foods that you're eating, your fried foods, your salty, crunchy foods, the things that aren't in their most natural state do add in an element of that inflammation piece. Then you pair that with other things that you've been hearing Kevin talk about. We start to have, stress, poor sleep, lack of movement. We've got all of these different things going on, and we just start to continue to elevate that inflammatory response in our body. And that again has a big impact on, when we're trying to eat better, move, exercise. There's just a lot of factors going on that take a while to start to release those things. And as Kevin was pointing out, if we haven't gotten certain things figured out at a cellular level and gotten certain body systems back into a more regulated state, it just is a harder fight to get that inflammation out of our body.
Okay. Here's a hot topic question, and it's one that gets us into a lot of debates with various positions. But every time you open the internet or look at a book or whatever, you're going to see somebody promoting a particular kind of diet, not only just for general weight loss, but especially for thyroid patients. They love to target us with, the thyroid cure diet. This is going to be the way to go. This is going to be the solution for you. And I've seen it all. It's, and every year there's some new program, and I've been around long enough to see them all. But when it comes down to it, there are a variety of factors that go into trying to figure out a way to eat a diet that actually makes sense for a thyroid patient trying to lose weight. So, Kevin, if somebody wants to lose weight, is there a particular diet? Is it an autoimmune protocol, keto, genic, paleo, low glycemic, carb controlled, low carb? There's so many options out there.
Yeah.
Time restricted eating, intermittent fasting. We've got all these different options. What factors should a thyroid patient look at as far as diet if they want to improve their health and lose weight?
We have 3 hours for this call, right?
Yes, exactly.
Yeah, that's a hugely loaded question. And there's a couple things. I mean, diet, it plays a huge role, going back to the things that Jill talked about. I mean, inflammation is primarily spurred by our food choices. You can create massive changes in the inflammatory environment of the body, mostly through diet and nutrition. And what I talked about earlier about that hypothyroid cellular phenomenon that happens, one of the reasons why that happens is because of chronic inflammation. So you can help people dramatically with thyroid issues by doing nothing but getting their inflammation related to their diet under control. Now, that's going to create a topic of, well, what diets are somewhat anti-inflammatory? The paleo diet is pretty anti-inflammatory, right? That'll take people from like a standard American diet with a lot of junk food and kind of put them on more vegetables and pull out a lot of grains and pull out dairy products. So you're starting to pull out like processed sugar. So you're starting to lower inflammation. So that can be helpful. Keto diets can be relatively anti-inflammatory as well, right? Because you're going to pull out a lot of grains. You're going to pull out some inflammatory things. Also, some keto diets are very unhealthily done. You can go all the way to something like an autoimmune paleo, right? Which I've known some of the top selling authors on thyroid disorders have written books, and that's the diet they put everybody on. And you know what? Every person that comes to them for a consult, they put on an autoimmune paleo diet, and like 90% of people will feel better within the first 3 weeks before you even do anything else. Because when you lower inflammation, you're going to improve the communication in the endocrine system. You're going to start to remove some of the clouds from the receptors on the cellular membrane and allow whatever thyroid hormone is there to work better. You're going to calm down inflammation in the thyroid. Thyroid is going to work a little bit better on its own. So anything that you do to lower inflammation is going to be helpful. I would say probably one of the biggest misconceptions that I have found in my 20 years is that there is an appropriate diet for a thyroid patient. That is where I completely disagree. I believe that the fundamental principles of what it takes to get somebody healthy are generally the same. The human body was designed to eat a certain way, and fixing the thyroid issue is what's important. And it doesn't matter whether you're dealing with an autoimmune disorder on the musculoskeletal system, or you're dealing with a digestive disorder, or you're dealing with a thyroid disorder, or you're dealing with some other endocrine disorder. There's only so many foods that can be healthy for a human, right? And it's not that hard to figure out, right? It's the things that God gave us to start with. So a lot of processed food, all the things that Joe was speaking of, they create problems. I have a specific philosophy in my diet. In my clinic, I'm ready to start if I just advertised, if you're between the ages of 45 to 65 years old, female, and are having trouble losing weight, we have your solution. Because every single woman that comes in that age group has been told, to me, the biggest misconception is that they need to consume a massive amount of protein. And they are eating every single kind of protein-laden food that they can get their hands on. And thyroid condition or not, they're struggling to lose weight, and it's not working. And those types of diets that rely heavily on a lot of animal protein, particularly keto diets and, diets that advocate a lot of animal protein and demonize carbohydrates, they actually don't work for a lot of the people that I see come into my clinic. And I don't think they're healthy. I mean, there was a good study that came out in, I think it was in the Lancet. It was about 2 or 3 months ago. People on a low carb, high fat diet, which is an acronym LCHF, low carb, high fat. It's like basically a keto diet. This was a study of over 10,000 people in Britain, double the risk of heart attack. It is not a diet associated with longevity. While somebody may be arguing and saying, well, geez, Dr. Passero, you don't know what you're talking about. That's the only diet that helped me lose weight. It may help you lose weight, but if it's going to lead to your early death from a cardiovascular event, really, what good was it? And we promote a much more balanced diet that is in line with what the research clearly demonstrates is associated with reduced cancer risk, reduced diabetes risk, reduced cardiovascular disease risk, and longevity. And if you apply that correctly, people will lose weight if you've done the right underlying balancing acts for their other hormones, and it equates to removing inflammation. So again, I mean, I get 5 minutes to respond to these questions, and they really necessitate hours of discussing, because I bring up topics that are going to spur a thought for somebody and maybe confuse somebody or go against what they've experienced. But everything that I'm talking about is based on my 20 years of clinical experience and detailed evaluation of all the research and on nutritional science.
Thank you. Thank you.
Yeah, Mary, I'd love to just hop in from the health coaching perspective
do.
on a lot of that as well. In terms of that question of, is there any one diet? And, Kevin brings up a lot of great points of why one might not be the right thing, that people might have success in the early, build that confidence, and then be ready, hopefully, to build into those lifestyle habits. Is that any one diet can also become hard long-term from a lifestyle perspective, because we're dynamic people and we don't just live in our homes and don't just eat in our homes. And so from a health coaching perspective, helping somebody to release inflammation, find the foods that help them, work best, is that's where we're looking at their, what is your life like? What does a day look like from the moment that you wake up until you go to sleep, to help them figure out what are those little habits that I can start to implement along the way that then build up into the greater whole, but picking, one or two things at a time to start on, and then adding in more over time, and finding the balance of, what is that, kind of anti-inflammatory way of eating that's not going to be filled with all of those, processed foods and things like that. So that, and then our role is really supporting the work that people like Kevin are doing, where they have those ability to do the testing, to get to those root cause, find those diagnoses, and then help them start to implement those changes.
Great. Jill, I'm going to stay with you with a question, because there's a lot of buzz right now about losing weight with medications. Anybody who's on TikTok and Instagram knows that you got Kardashians coming out the wazoo talking about how Ozempic is the answer. You got a lot of celebrities that are doing Ozempic. There's people that are pushing Contrave, which is the LDN and Wellbutrin combination. What do you think? I mean, when patients, and we'll get Kevin to weigh in on this as well, but when patients are talking to you and they're sort of looking for medication solutions for weight loss based on things they're hearing from People Magazine and Entertainment Tonight, what are your thoughts about that? How would you counsel one of your coaching clients who said, I want to, forget about what I'm eating, I want to do Ozempic, because that's what, Khloe Kardashian lost 30 pounds using it, so I think I should go on it?
Yeah, no, it's a great question, because it is a hot topic right now. First, to just understand, a health coach, we cannot diagnose, we cannot prescribe. So when somebody comes to me and says, should I take Ozempic? It's not in my scope of practice or in my expertise to be able to say yes or no to that. But what I would do as a health coach when somebody comes to me and says, should I be on one of these types of medications, is first really exploring, what it is about weight loss that they want most. What is weight loss going to mean to them? What are the benefits of weight loss going to be? Starting to look at what is your day-to-day life? What types of things are doable for you? And in terms of getting on a medication, that's where I'd have to, refer them to their doctor, that they'd have to have that conversation with their doctor, but really trying to figure out their motivators, like their intrinsic whys, to see, are they somebody where they may want to go to their doctor, they may want to get on one of these medications to just kind of jumpstart and kickstart things, but really be able to start then implementing habits if they're working with a coach, or even doing things on their own, where they start to see some success and feel better about things. And I'm not saying this in the way to say, this is the route that you should take. I'm just saying this is examples of what I've seen. Other people will, I've seen them not choose that route and just go the route of, trying to implement the lifestyle behaviors, but really doing it from that source of, why do I want to be losing weight? What is weight loss going to do for me? What is it going to mean for me? What am I willing to put? Like, what time, energy am I willing to put into this, so that they can figure out what's going to work best for them to go down one of these routes or not. In terms of just the medications themselves, I really don't honestly know a lot about them, but the research that I've seen, some of the reports that I've read, and some of the talks that I've listened into from other dietitians and experts in the field, is that it does look like when you go off those medications, people oftentimes start to gain weight again. So, from a coach perspective, safety is always a big thing for us. So I would want to also make sure that if they're going to explore these types of things, that they really talk to their doctor a lot, that they do their research, they find out, safety, long-term side effects, things like that. But as a coach, we're really there to help somebody figure out what they want to do most versus just telling them what to do, and then helping them implement those things in the way that's going to keep them as safe and healthy as possible. And sometimes it is going to be a route where somebody has chosen one of these medications.
Makes sense. Makes sense. Kevin,
Yep.
what do you feel like when somebody comes in and basically says, I want one of these medications? And because I think the tendency with some patients is maybe to look at them as the magic bullet or the magic cure, the quick fix solution. And there, as Jill was mentioning, there is issues I'm seeing with people taking the Ozempic for weight loss, and it's a diabetes drug. It's not a weight loss drug, but people are taking it off label for weight loss, but they are having rebound weight gain, which then introduces the problem that you were talking about losing weight rapidly and then regaining it and having it go into visceral fat. But if a patient comes to you and says, look, I hear you, avocados and kale, and yeah, I should be eating this and that and everything else, but I just want to lose the 30 pounds. So can't you just put me on the Ozempic?
Right. Well, I mean, I don't do that in my practice, right? If I have had patients that have wanted to explore that.
Right.
I've had several that have gone down that route, some with success, some without success. Some decide that that's what they want to do, and then they read the side effect profile of the medication in the actual packet, and they decide otherwise once they see the risks that they're taking on. The reality is that I don't, we're obsessed in our culture with fast results. I mean, that's what everybody wants. They want the easy solution. And drugs are engineered to oftentimes manipulate physiology in a very powerful way and sometimes deliver a little bit of an easier solution. I don't really have any cases that I've ever worked with in being in practice for 20 years where, I mean, Ozempic has only been available really even off label like that for the last maybe 3 years, right? It hasn't been around that long.
Right.
So I've had to figure out other strategies. And what I've learned is that if you actually properly balance the body, there's no need for that drug. Now, some people may not want to go down that road. They don't really care about the avocado or the kale, or don't really want to understand how to properly nourish their body to bring it into balance. But, listen, it's my practice. There's a lot of things that I don't get to decide in this life, but I do get to decide how I run my practice. Right. So, that's not part of it. There are some situations where I have found that patients do benefit from some medications. When there's a long established thyroid issue, there is a subset of particularly women. Are we okay on time? Should I?
Yes. No,
okay.
Please.
All right. There is a subset of women that have not necessarily even a specific diagnosis, but have some characteristics of polycystic ovarian syndrome, of PCOS, which can really complicate metabolism even after you've put a lot of the gears in place necessary for balancing the thyroid. And they do need to break a plateau, and you do need to get their metabolism kickstarted a little bit. And in those cases, some drugs like metformin have been beneficial and useful. There's other dietary programs that I've used and other doctors have, patients have done through other doctors using HCG, which is a really old school method, but it can work to sometimes reestablish some sensitivity back on the sex hormone side, which, sometimes needs as much or more attention than the thyroid, even if a person is presenting with both. So I think there is a role for medications, when you're really, really stuck, but I don't even really consider those options until we've gone through all the basics, because over 97%, 98% of the people that come through my door will get to where they want to get to before we even consider medication options. But so it's got to be right for everyone. The last thing you want to do is prescribe a medication to try and get a quick fix, come off of it, and then have them regain the weight. It's just not a good scenario.
Definitely. we have a question coming in from one of our readers, viewers, I'm saying readers, viewers, who wants to know a little bit about, you mentioned the HCG diet, and they're not familiar with that. And can you explain a little bit about what that particular diet involves, or what that particular treatment approach to weight loss involves?
So that was developed back in Italy in like the 1950s, and it was used as a way to stimulate weight loss. Human choreographic gonadotropin is the hormone that's most associated with pregnancy. That's what they measure, determine if like a woman's pregnant in early pregnancy, but it's not necessarily a female hormone. It's been used for a variety of different things in endocrine disorders. And the idea behind it is that it helps the brain access fat that is not able to be accessed through normal caloric restriction and weight loss strategies. So some people you'll see will diet through caloric restriction, trying to shrink a problem area, maybe in their hips or in their abdomen, and they kind of get gaunt and lose weight everywhere else, but that one problem area doesn't really change all that much. The brain sort of loses the ability to access some of those areas of fat, even for storage. And the theory is that HCG is one of its survival mechanisms in pregnancy, is to allow a pregnant woman access to all of her energy stores. Because let's face it, we didn't always have grocery stores down the street. You know, human history is wrought with feast and famine. So it was very beneficial for women to be able to access all of their fat stores during pregnancy to make sure they had enough energy for themselves and for the developing baby that was in their body. So what HCG does is uses these tiny little micro doses of HCG, doses so low you can't even detect them in any kind of standard blood work. And it basically just puts enough input into the brain to start unlocking those fat stores. And you pair it with a relatively low calorie diet. So, but the idea is that you're not really putting that person into a metabolic deficit by putting them in calorie restriction for a long time. And you see that clinically because people don't report hunger. They don't report fatigue. They feel like they're eating their normal 1,700 calories a day, or 1,500 or 2,000 calories a day if it's a man or a woman. And really they're eating 500 to 700 calories a day, but they feel amazing. And it can sometimes just start to reboot the metabolism a little bit. And I've had some, particularly women, who were very stuck even after we adjusted their thyroid, and taking them through that not only helped them to lose weight, but it allowed their body to continue to lose weight even after they return to normal eating. Now, we will only consider somebody to do anything along those lines if they've been working with our nutrition advisors for at least 6 months or a year, because if they don't have the fundamentals in place of how to actually eat healthy, then what they'll do is lose the weight and then stop the program, go back to old eating habits and gain it back. And there we have our same problems. And I learned that early on when I first started using the diet. I thought it was really a great way to help people, and people were just using it as a way of yo-yo dieting. So I pulled it from the clinic. I thought it was not ethical. And basically, if I even consider it, it's only after somebody's clearly demonstrated that they've made the significant lifestyle changes that I know are going to be necessary to maintain the weight loss, and have been incorporating it not as a diet, but it's an enjoyable lifestyle that they're living. They're just still a little bit stuck.
Right.
You know?
Okay.
So that's the idea behind it. You just have to be careful with it, because people will advertise it as one of those shortcuts. And if you don't have the fundamentals in place, it's just going to be another short-term tool that's going to result in, long-term losses.
Okay. We have another question here from somebody who wants to know, I'm hypothyroid with Hashimoto's. I'm very thin and I can't seem to gain weight. It makes me wonder if I'm really hypothyroid or am I hyperthyroid? What can I do to gain weight? What should I be eating? So here's the opposite question. It's interesting. Here we're talking about weight, having a healthy weight, and everyone's mind always goes to being overweight. But here's somebody who wants to gain weight, but is hypothyroid and Hashimoto's. Jill, do you have any thoughts? And then we'll jump over to hear what Kevin has to say about that too.
Well, I will be totally honest. I haven't actually worked with anybody who wanted to gain weight. So I have no, professional practice in this. Just as a health coach, anytime somebody wants to do achieve some type of goal, we're going to look at what are you currently doing and things like that to see what could we be doing differently. But I would actually really probably punt this one over to Kevin more.
Okay. Yeah, I'm happy to take it. I think it brings up an important question, right? Because there's all these assumptions about hypothyroidism, like you're going to be overweight, right? And here's somebody who's not, and this is not uncommon. I think what people need to understand, the most important thing that whoever asked this question, if you're watching or listening still, you know, these medical conditions don't always exist in isolation. So even though you've been diagnosed with an underfunctioning thyroid, your inability to gain weight may imply that there's another congruent imbalance in your body that is going on that needs to be vetted and looked at, right? So are there digestive issues? Are there other potential chronic illnesses? Are you hypothyroid and you were put on thyroid? Do you feel amazing except for the fact that you can't gain weight? If that's the case, then maybe there isn't something else going on. And maybe you just need to have your nutrition tweaked a little bit, or perhaps is your thyroid medication properly regulated? Are you maybe a little over medicated? Could that be an issue or a problem? If you're on your thyroid hormone replacement, whatever's prescribing it, and you're not feeling perfect, and you're still having other symptoms that are associated with lack of vitality and how you feel overall, then there may be another issue going on in connection with your thyroid. And it is one thing that I find, there's a lot of association between when people get a diagnosis to really identify with that diagnosis. And sometimes it puts a level of blinders on them where they really focus on that specific thing, not realizing that there are multiple systems of the body that can have imbalance that can manifest with different symptoms. Certainly, the approaches to gaining weight are going to be, trying to increase the caloric amount, getting a little bit more carbohydrates, getting a little bit more fat in the diet. I always like fat from whole foods if you can. So that would be maybe eating, more nuts rather than just eating a lot of nut butter. And instead of getting calories from a lot of free oils, eating the actual food that contains the oils. And if you're, a little bit underweight, a little bit more carbohydrates may help a bit. But a lot of people have tried that. And if they're still not gaining weight, usually there may be something else going on that needs to be vetted out. That's my gut on this question. And that's what I would encourage this person to think about and to look at. And if their sort of instinct is telling them that something else might be going on as well, then they need to find a provider who can help sort of cast the net a little bit wider, unturn some other stones, and really dig through what else might be going on in their body.
Sure. We have another question, and this is kind of an interesting question. And I've heard it too, because we see out there, I mean, we've got a, medium who in between, connecting with Dead Aunt Mildred is giving us medical advice on our thyroid, who's told everyone that celery juice is going to cure a thyroid problem. And I've also seen people that said, well, I did a, cabbage diet, and for some reason my thyroid got great. And, there's a lot of people trying to sell you the idea that certain foods and certain weight loss approaches are going to help your thyroid. Can certain foods or weight loss resulting from certain foods actually cure my thyroid problem, Kevin?
Okay, well, it depends on where your thyroid problem is at, right? If it's early and it's very minor and you're eating a relatively standard American diet, I have had patients that switch over to a very low inflammatory, nutrient dense, very balanced, healthy diet, and they can really revert back on a subclinical hypothyroidism. It's kind of right on the fence. And there's even a certain percentage of people where eliminating certain foods that are highly antigenic from their diet, if it's early stage, may allow you maybe see normalization of antibodies. It's rare, and people will purport that it happens more frequently, in my opinion, than it actually does. But it can happen. And there are a lot of people that have maybe a borderline thyroid issue that I'm watching. They've got a TSH that's riding up above 4, but not quite out of range. We're sort of keeping an eye on it. And all of a sudden we really putting them through the paces of really getting healthy and well. you know, they commit to doing a really extensive nutrition program with us, and they're working with my dietitian and with me. And, you know, lo and behold, 3 to 6 months later, I'm monitoring their thyroid function and it's looking really normal, and they're displaying no signs of hypothyroidism. So while I was on the fence with, do I need to prescribe something or really do something for this person? Fast forward 3 or 6 months later, and the answer is absolutely not. You know, and I see that not just in thyroid, but like I won't even consider doing anything with testosterone in a man until we go through diet and nutrition, because I oftentimes see testosterone levels go up 100, 150, sometimes 250 points in a man with nothing but dietary changes, because the endocrine system is so sensitive to inflammation. Now, if you've had a thyroid condition for a long time and you've had Hashimoto's for a while, and you know your TSH is going to run high off medication and your antibodies have been elevated, anybody selling you the idea that you're going to use diet alone to completely reverse your thyroid issue, I mean, you know, please send them my way, because I haven't seen it. I've looked at all the literature. I've been doing this for 20 years. And while I would love to do that, if people call me and say, I want to get off all thyroid medication, I've had a thyroid condition for 15 years and I want you to help me treat it totally naturally without any thyroid hormone, my first response is, realistically, I don't think that's possible. You're going to feel better if we have you on it. We may be able to reduce the dose. We may be able to get you feeling better. We're going to get you balanced out. But, you know, the autoimmune component of Hashimoto's does create damage to the thyroid. And until we figure out fully how to restore that, and once that autoimmune process is in place, it's very hard to completely reverse it. If it's early stage, that's one thing. I've had a lot of patients where I've had to reduce their dose of thyroid medication. What they were once feeling good on, they now feel over medicated on. Right. As they go through the proper lifestyle and dietary changes and reduce their inflammation, and we bring their body into balance. So they're on less and they feel way better, and they're losing weight finally, and they feel amazing, and their lipids are improving and all their markers are improving. So it's an amazing transformation. You can't just sneeze at that. Right. But it's not this idea that any food's going to completely change it.
Okay. One last question for Jill. Jill, in some of the work that I've done with patients, I've heard some really interesting things. I'll ask a thyroid patient, well, when's the last time you were able to lose weight? And they'll say, well, 3 years ago, I was eating a really great low, sugar diet. I cut out all the sugar, and I was doing this and I was doing that. And I wasn't eating dairy, and I lost 10 pounds over the course of 2 months, and I felt really good and kept it off for a long time. And I'll say, well, like, why are you having a challenge with weight loss now? Are you eating all those carbs? Yes. Are you eating the dairy? Yes. Why are people sabotaging themselves sometimes? And I'm sure Kevin has seen this, and I know that you are seeing this as well. But we have situations where patients, they know they have to take their thyroid medicine every day, but they don't always do it. They forget. And we know that some people just don't do well and can't lose weight if they're eating dairy or eating heavy carbohydrate diets, but they still do it. And then they're wondering why things aren't going their direction. How, as a patient coach, how do you get into that discussion with a patient to try to kind of get them thinking in the right direction?
Absolutely. Yeah, it's a really common thing. We do stuff for a while, we see results, and then for a lot of different factors, it goes off the wayside. In terms of thyroid patients, one thing to look at immediately would be, having them see a physician. Like, what are your thyroid levels doing again? Is something out of whack? And then, because of the symptoms that they're starting to say, they don't feel good. They're exhausted all the time. They have the brain fog. So when you're exhausted and you have brain fog, it's really hard to want to get into the kitchen and to cook yourself a really nutritious meal, or get out and go for a walk, or lift some weights, or engage in, a bedtime ritual that sets you up for really good sleep for the night. That they feel weary and they feel worn out. So, Kevin's mentioned it today already, is just one, really looking at, is there something that needs to be done here to get things re-regulated, to get them feeling better, to get their numbers back into a level where they can say, I'm starting to feel like a human being again. And then now starting to go into those questions, like you've asked people many times, of, well, when did you lose weight the easiest? When did you feel the best? What were you doing? And then exploring, so what's different in your life now that's creating some of those roadblocks and those barriers to doing those things that worked back then.
Mhm.
Also understanding that we're bio-individual and we're unique, dynamic individuals where what worked 3 years ago, 2 months ago, 10 years ago isn't necessarily going to always work now. It might not be the exact same set of habits and circumstances and things like that. So then also now looking at, well, what's going on in their life right now? What are habits that they can implement with what they've got going on in this moment? And trying to find the things where they start to see those results. They start to build that confidence. They start to build that excitement again and that motivation that keeps them coming back for more, because now they're really seeking that reward of how well they feel every day, or the clothes that are fitting a little bit better. And sometimes too, that's the other thing, is really exploring, what does success look like to you? For one person, it may truly be that number on the scale. For another person, it may just be that dress in their closet that they bought 5 years ago that they've just been dying to wear. And if they can put that dress on, it doesn't matter what the scale is or anything else. That's exactly what they want. So really finding out what it is that they're looking to achieve and helping them move in that direction.
Okay. Wonderful. Well, I think I could keep asking questions because they're still coming in from our viewers, and I could keep talking for hours because you both are just amazingly interesting, and there's so much information, and we could keep, right, Alex? We could keep talking about this for quite a bit. But I would really like to thank our guests, Jill Ellison, health coach with Paloma, and Dr. Kevin Passero, a naturopathic physician in the DC, Maryland, Virginia area. And thank you so very much to both of you for sharing all your wisdom and common sense. And, it always gives me inspiration when I hear people talk about the different ideas and the different ways of doing things. It makes me motivated to go back and eat more avocado and kale and get inspired. So thank you very much for joining us. And people can find Jill here at Paloma. She's working with various patients in her capacity with Paloma. And if you're looking for Kevin Passero, it's greenhealingnow.com. Did I get that correct?
Yeah, that works.
Green Healing Now. And if you're in the DC area, you can see him in person or out in Annapolis, Maryland. And so thank you again to both of you. And I'm going to turn it over to Alex to finish things out.
Thanks, Mary. Yeah, thanks again, Dr. Sarah and Jill, so much for your guys' participation. For everybody here that's still attending, if you have any questions for Paloma Health, you can always reach out to us on social media. You can go to our website, palomahealth.com. As I mentioned before, we have an unlimited number of resources from our blog, as well as downloadable guides that you can do. If you also are navigating AIP, for example, to help reduce that inflammation load, we have a free AIP course that you can navigate and go through completely. And that has been really successful for a lot of patients in helping bringing those antibodies down and just overall inflammation in general. Again, we have the Paloma app. It's a free download. It's based for US users only. So free download, you could go ahead and track all your symptoms, do all the medication reminders and everything like that. And if you would like to book a visit with any of our nutritionists on staff, or, potentially become a member, you might end up working with Jill and she can help support you in your lifestyle. And again, if you would like to see Dr. Passero, you can head to his website. But that's basically it. Thank you so much for joining us today. Again, thank you guys for being here and joining us. And Mary, of course, always rocking the show like always. And any questions, reach out to us, palomahealth.com, and we're more than happy to help you. So until next time, guys, take care.
Thank you